our next question, and it goes to Beth Hogan.
In the second quarter of 2016, more people died of fentanyl-related overdoses than heroin-related ones. This was just announced last Friday by the Office of the Chief Medical Examiner. The state has taken some measures to address the opioid epidemic, and yet we are constantly hearing from families that there aren't enough detox beds available or that treatment is too costly. What do you see as the state's responsibility in addressing this issue?
Well, this goes to public health and welfare. I consider it a public health crisis. It's hit our community very hard. No, there's not enough treatment beds. No, there's not enough outreach. No, there's not enough Narcan that's available. Should be available to everybody that wants it. And yes, we should have it in our school systems. I went through the Narcan training. It's very simple. And there's a lot of things that are out there that we should be, as a community, working on. Community Speaks has been a great group for people, and I'm sure many people in their family, I know family members that I have suffered from that. It's a crisis, because what are we doing? And what we need to address it, because we have a responsibility as citizens of the state to help each other out, too. It's a crisis, because we're draining resources. People need treatment. They're not getting treatment. People are losing jobs, money, homes, houses, goes on. It multiplies. It's dragging down everything. And it's a truly clear problem. Now, I'm proud of the fact that some municipalities are stepping up. They have been doing it, but it's a state, municipality, police, community, parent, school partnership. There's a lot of great ideas, and there's a lot of things that are happening. Now we have the opioid, task force here in Connecticut. I have gone to some of those meetings. I think that collectively we know that it's a crisis. I hope that we're beyond saying, well, there was a choice in the matter. Yes, everything starts off as a choice, and when we talk about morality, but that's not going to win the day. We need to help people, treat people, and make them better. So access to treatment beds, access to proper licensing. What we have to watch out for, and I was happy to see that New London is doing this, is getting a registry of the sober houses, because they're truly not, most of them, I don't think, are treatment facilities. And sometimes that becomes the only choice for someone to get treatment, and you're actually putting them in a place where they're more likely not to succeed. It's basically, I look at it as, we'll call this a sober house, but we'll charge you X amount of dollars to live here, and you can go downstairs and attend a meeting. That's not treatment. That's not really doing it. So we need to look at models like in Florida that I had some family members go to that have come back and are doing very well. We need to look at things and making it accessible. We need to look at ways to get insurance and get some type of partnership going in order to pay for services where people can't pay and take care of people. And we saw something in the day today where somebody couldn't come up with $1,500 to stay at the Stonington Institute, came out, overdosed, died.
Mrs. Cheeseman, if you could talk about the opioid crisis and what you would be doing as a legislator to address it.
Well, the National Governors Association published a very interesting series of papers dealing with just that, because it's not just a Connecticut issue. In fact, I think our neighbor Rhode Island has the worst problem in the country in terms of deaths and overdoses. Among the things they discussed were the importance of PDMPs, or prescription drug monitoring programs, whereby you are tracking the doctors, making sure there are no pill mills, making sure you're not finding a disproportionate amount of prescriptions coming from one area. I think there was a piece in the Current last week. There was one facility, 4 of the nurse practitioners were responsible for 80% of a particular opioid prescription in the state. That's the kind of thing we should be looking at. We should be looking at medication-assisted treatment. So you have an addiction. Let's use medication to help you get off that drug, whether it's naloxone, whether it's methadone, whether it's one of a number of drugs. This should be incorporated both in private settings, but also in the public settings. If you're incarcerated, we should be able to help you get off your addiction. We should look at, and this is a federal issue, currently, if you are incarcerated, your Medicaid is canceled. You come out, how are you going to get treated? You may be getting treatment in prison or in jail, but you come out and you have no way to pay for it. I think that would require Connecticut to seek a waiver. And we have to look at the way Medicaid pays for inpatient treatment for substance abuse. Medicaid will not pay for inpatient treatment for anyone under 65 in a bed that specializes in treating people with mental disorders that has more than 16, in a facility that has more than 16 beds. That goes back to the founding of Medicaid. That makes it very hard for people who don't have the income, who are relying on the state to get the help they need. And again, that's a federal level issue. But I would certainly look at the recommendations that have been made in terms of getting everyone in the community involved, from the local police, who are very often the ones who are administering the Narcan, finding these very, very sad individuals, male, female, young, old. And then we can't just say, okay, we brought you back. Where do we go from there? That's where working with the community, working with hospitals, emergency rooms, local doctors, social service agencies, we have to have a net that catches people, gives them what they need to recover, whether it's with the assistance of medication, with other counseling, and help them find a better way ahead.